There's two sides to every story, and physicians, most doctors, when they graduate residencies or fellowships, they only see one side. They only see the side of the hospital that they're working at. They don't really see how things are on the outside. They don't really see the real story behind the money in healthcare. Hello, I'm Dr. Alexander Lakowski with Reimbursement Rx. In our last video of the year, we just want to summarize what we've done, give you a little bit of a glimpse of what we're going to do in the future, and tell you what we're doing right now. As you know, Reimbursement Rx is an organization or company for doctors, run by doctors, and our main objective is to educate docs about how the business of medicine works. This is for everyone, for established physicians, new residents, or new fellows. We are here to help you navigate this very complicated and sometimes idiotic world of medical reimbursement. A lot of doctors don't understand why they get paid what they get paid, or when doctors are getting employed, they don't really understand how the money is being passed down to them. A lot of you are being paid by RVUs, which is extremely unfair system. A lot of you are being bullied into signing contracts saying that, well, this is the best thing you're ever going to get. And we kind of demystify all that. And through a series of videos and seminars, we bring to you what's really important.
This is your RVU system. For doing more work, you ending up paying a lot more money to your hospital, and you shouldn't be doing that.
We are trying to make your whole career path much easier and much more fulfilling for you, because you'll know that you're going to get paid as much as you deserve to get paid.
Remember, like I said, it's almost a taboo when it comes to money. And doctors, well, no longer so. Your services are needed in such great and there's such great demand that it's totally fine to ask for it. And you know what? And if you ask for it and they don't give it to you, well, so what? At least you've asked. But nothing will happen if you don't ask.
So we talk about it all. We explain the RVU structure, and we tell you how to negotiate for the better one. We explain how to negotiate contracts. Even if you're an independent physician, you still need to know what you need to ask from various insurance companies, and how you need to position yourself in whichever community you're practicing at, so that you get the best deal possible when you're doing bill for your patients. And if you're employed by the hospital or a large medical organization, it is very important for you to know how to negotiate. And it's important for you to know what to ask for. And the most important thing, not to be afraid. And of course, one of the most important things that Reimbursement Rx can do for you is also to explain how the billing mechanism works.
This is 1.42 work RVUs, and it pays much better than the level 1. Remember, level 1, how much was level 1? 44, from 44 to over 100. You're more than doubling your reimbursement by doing anything and everything you're doing anyway.
How to bill for your services, and how to bill for your services correctly with adequate documentation, yet not writing too much, but yet asking for the highest amount of reimbursement. And to that extent, we brought up a very new proposal from Medicare that was actually proposed in the summer of 2018.
The new Medicare proposal to pay physician a flat rate for all levels of services is absolutely the worst proposition ever made by Medicare in the last few years.
The proposal was that beginning next January 2019, all your outpatient visits, all your outpatient visit codes would be bundled into one payment. That would undoubtedly result in significant reduction in your reimbursement. And due to pressure from physicians and various doctor support groups, actually that didn't happen. Medicare just recently announced that, well, they're not doing that, so everything's staying put. So you're not going to see a decrease in your Medicare reimbursement. As a matter of fact, you might see a little bit of an increase depending upon your participation in MACRA and various other quality services, which we also touched on in the past, and we'll talk about it in a minute. But the bottom line is, for years 2019 and 2020, for the next 2 years, there'll be no change in how you code. But 2021, look out, it's coming, and we'll talk about it. And it's very important to know it today, because 2 years from now seems like it's a long time, but really it isn't. In year 2021, what Medicare is proposing is that all of your outpatient services for patients, if you're still doing fee-for-service medicine, will be bundled into one payment, except for one code. Do you know which one? Sure, 99215. The highest code that you can do in your office will still be paid at whichever rate you're getting paid at, depending upon your location in the country. But anyways, this is very important to know. Why? Because all insurance companies will eventually follow Medicare's lead. So we got a couple years to prepare. We got a couple years to complain. But most importantly, we got a couple years to educate people so that you know what you're getting into. Because this will affect everything. This will affect your RVU reimbursements. Because now it's going to be only one code. It's going to affect your overall reimbursement because depending upon your specialty and depending upon your location, as we said before, your reimbursement will go down. So we got 2 years to prepare, and we'll help you with that. And as we just touched on, the MACRA, which is another big incentive program for Medicare that pays for your quality. I'm sure at a local level you know all about it, you're participating in it, and you just play percentages there and see if it makes sense for you. Yes, you do get a little bit of increase in the reimbursement for Medicare. You rather get a little bit decrease in reimbursement for Medicare if you do not participate in the program. But what you need to do is look at the numbers and look at how much time it's going to take you to comply with these provisions and participate and attest to what you're doing versus how much reimbursement, how much less you'll be paid if you don't do that. And if it takes too much time, certain physician groups decided to screw it. They decided, we're not going to do MACRA, we're not going to participate in it because it's taking too much of our time. In fact, we're going to see patients, we're going to provide patient care instead of the time required to do all this documentation. And we're still going to make money, it's just that we're not going to do the stupid busy work that the government wants us to do. There's two sides to every story, and physicians, most doctors, when they graduate residencies or fellowships, they only see one side. They only see the side of the hospital that they're working at. They don't really see how things are on the outside. They don't really see the real story behind the money in healthcare. 2019 is going to be a very interesting year because of all the changes on the horizon, because of God knows whichever reform we are going to have coming from our top legislators. And it's very important to stay on top of it all and make sure that the most important piece of the system, which is the physician, does not get screwed. And Reimbursement Rx is here for you just to show you how you can succeed and get paid what you really deserve. I'm Dr. Alexander Lakowski. Thank you for watching. Happy New Year, and we'll see you in 2019.